Let's start our discussion on pelvis. So pelvis, first we need to see what are the different parts of pelvis. So coming to the parts of pelvis, first thing is pelvic brim. So already if you see our anatomy videos, you'll understand whole anatomy we already discussed. Now today we are going to mainly discuss the important points regarding to pelvis. So pelvic brim, from anterior to posterior it is formed by, on anterior side, first we will be having pubic symphysis. Okay, so following pubic symphysis you will be having a pubic crest. Okay, and after pubic crest you will have of course pubic tubercle. After pubic tubercle you will have iliopectineal eminence, and after that you will have iliopectineal line. Okay, after that you will have sacroiliac joint. Following that you have ala of sacral bone, ala of sacrum, and following it finally you will have sacral promontory. So about every structure I already discussed in very much detail in our previous anatomy videos. Okay, so parts above the pelvic brim, all the parts which are above the pelvic brim are called as false pelvis. In this false pelvis will not support any labor process. It is just supporting the gravidum uterus. Next, coming to the parts which are below the pelvic brim. Below pelvic brim it is called as true pelvis, and this take parts in labor. So now coming to parts of true pelvis. Parts of true pelvis have one inlet. So let me draw for example the pelvis like structure. So just an imaginary diagram. Okay, so here you will be having sacrum and coccyx like this. Okay, so just an imaginary diagram, imagine in a 3D way. So this part from which it will enter, this is the pelvic brim. The structures which are above pelvic brim is false pelvis, below pelvic brim are true pelvis, and the upper part it has an inlet which lies at the level of pelvic brim. Okay, and the cavity lies at the level of S2 S3 vertebra. So let me write here inlet at the level of pelvic brim. Okay, cavity at the level of S2 S3 vertebra. And coming to outlet is divided into obstetric outlet and another one is anatomical outlet. Okay, obstetric outlet lies at the level of ischial spine. You can see here this is ischial spine. So at this level you will have the obstetric outlet. Coming to anatomical outlet, it lies at the level of ischial tuberosity. So at the level of ischial tuberosity, this is very important. Obstetric ischial spine, anatomical ischial tuberosity. Both are outlets only. Next, coming to the pelvic inlet. Pelvic inlet is divided into anterior posterior diameter. This one is called AP diameter, and this AP diameter is divided into three types, that is the true conjugate, obstetric conjugate, diagonal conjugate. So true conjugate is upper border of pubic symphysis to sacral promontory. So this line which I have drawn now is a true conjugate. It is a total of 11 centimeters. Next you have another conjugate that is called as obstetric conjugate. It is from the midpoint of pubic symphysis to the sacral promontory like this. That is the obstetric conjugate, and it's like about 10 to 10.5 centimeters. And the next one you have diagonal conjugate. It is from the lower border of pubic symphysis to the sacral promontory, and this is of 12 centimeters. So 12 centimeters is diagonal, this one is obstetric, and 11 centimeter is the true conjugate. So you can see here among all this the highest longest one is diagonal conjugate from the lower border of pubic symphysis to the upper part of sacral promontory, that is 12 centimeters. And next biggest one is true conjugate, that is from the pubic symphysis to sacral promontory. And next comes the obstetric. It is from midpoint of pubic symphysis to the sacral promontory, that is between 10 to 10.5 centimeters. So you can see here the obstetric is the shortest one. This is the longest one. This is in the medium. Okay. So what is a critical obstetric conjugate? Obstetric conjugate is also called as critical conjugate because it is the shortest diameter of, you can say, 10 centimeters, and if obstetric conjugate is less than 10 centimeter, then vaginal delivery is not possible, and such pelvis is called contracted pelvis. So that's why we will take the obstetric conjugate as an important parameter, because it is the shortest one, right? So if it will be more shorter, then of course the vaginal delivery is impossible in this patient. So that kind of pelvis is called contracted pelvis. This is very important. Now coming to longest AP diameter, that is a diagonal conjugate. If the diagonal conjugate is normal or 12 centimeters, that is ideal, then the sacral promontory cannot be palpated by finger because it is a normal, right? So for example, if you put your two fingers from the lower side and if you want to palpate them, you can palpate the pubic symphysis on the back, you can't palpate the sacral promontory, then it is a good sign that your pelvis is big, so you can do the normal vaginal delivery. But in some cases, when you can palpate the sacral promontory, then it is very bad, because the diagonal conjugate, if is less than 12 centimeter, then this type of pelvis is also called contracted pelvis, and in this type of pelvis we can't do normal vaginal delivery. So actually clinically we will measure only the diagonal conjugate. That is very important. Clinically you will measure only diagonal conjugate. So what is diagonal conjugate? Normal, it is of 12 centimeters. Okay, so clinically you measure this, but obstetric conjugate we can't get it clinically. So how to find out that? Just you need to do 12 minus 2. So anything x minus 2 is the formula for obstetric conjugate. So 12 minus 2 will be 10. You will get the obstetric conjugate value like this. Or you can do like minus 1 also. In the case of TC means transverse conjugate. TC means true conjugate. For true conjugate you need to do just minus 1, okay, from DC. So DC minus 1, or you can write x minus 1, you will get the true conjugate. This is the formulas. So in this imaginary diagram, let me show the different lines which can be drawn in pelvis. So this diameter is called transverse diameter, okay, and I will explain them later, just I am drawing them first, okay. So first let us discuss about transverse diameter and oblique diameter of pelvic inlet. So here this is called as transverse diameter. It is a distance between two farthest points in iliopectineal line. Farthest points in iliopectineal lines, okay, that is this transverse diameter is about 13 centimeter. Next, coming to oblique diameter, it is a distance between one side of sacroiliac joint, like this, one side of sacroiliac joint to the other side of iliopectineal eminence, and this is called as oblique diameter, and this is of about 12 centimeters. Okay, this oblique diameter is of two types, that is right oblique and left oblique diameter. Okay, next coming to two oblique diameters, as we said, right side will start from the right sacroiliac joint, left side will start from the left sacroiliac joint. Okay, the shape of pelvic inlet in a normal female is oval, that too it is a transverse oval. Okay, so very important, normal female pelvic inlet is transverse oval, that the transverse diameter is greater than the anterior posterior diameter. If you can see, the transverse diameter is 13 centimeters, whereas the anterior posterior diameter, if you see, the greatest one is only 12 centimeters, so greater than 12 it is. So transverse diameter is greater than anterior posterior diameter in the case of pelvic inlet. Now let us talk something about pelvic cavity. The pelvic cavity lies at the level of S2 S3 vertebra and goes up to the midpoint of posterior surface of pubic symphysis. Okay, and the diameter of cavity, if you see especially the cavity diameter, that is the anterior posterior diameter of cavity, it is 12 centimeters and it is extending from S2 S3 vertebra to posterior surface of pubic symphysis. All diameters of the cavity, all diameters here are equal to 12 centimeters in the case of cavity. And the plane of greatest pelvic diameter, what is this? Plane of greatest pelvic diameter, the plane passing through S2 S3 vertebra. The plane which is passing through the S2 and S3 vertebra is called the plane of greatest pelvic diameter. Now let us discuss some details of pelvic outlet. Pelvic outlet. Okay, so pelvic outlet is if you see different types of outlet, there will be different shape. Coming to obstetric outlet, it is a diamond shape. Okay, and its borders are anteriorly, it have lower border of pubic symphysis anteriorly here. Okay, and posteriorly it will have the tip of sacrum, and of course laterally it will have the ischial spine. So the AP diameter of, you see, of this pelvic outlet, it is equal to 11 centimeters. So all these diameters we need to remember. Now coming to the transverse diameter. The transverse diameter of the pelvic outlet, especially the obstetric outlet, it is a distance between two ischial spines. Two ischial spines distance, and that is equal to 10 centimeters. And this is also called as interischial diameter and bispinous diameter. Overall, it is the smallest diameter of pelvis. Okay, and the most important diameter of true pelvis it is. Okay, and if the IID is less than 8 centimeters, then you can say it is a contracted pelvis. That is, if interischial diameter is less than or equal to 8 centimeters, then for sure you can confirm it as contracted pelvis, because in a normal pelvis it is 10 centimeters. If less than 8, contracted pelvis. So we need to go for cesarean section. Now coming to the measurement, how to measure this? Try to palpate the both ischial spine simultaneously with the two fingers of your hand. Use the index finger and middle finger. If both the ischial spines are palpable simultaneously, it indicates contracted pelvis. It should not be palpable, then it indicates it is a normal pelvis. So this plane passing through ischial spine is called plane of least pelvic diameter. This is also called as plane of least pelvic diameter, and the plane of mid pelvis is also called as plane of least pelvic diameter. Now let us discuss about anatomical outlet. So coming to anatomical outlet, okay, anatomical outlet is for this the boundaries, if you see, posteriorly it have tip of coccyx, and anteriorly it has lower border of pubic symphysis, and laterally of course ischial tuberosity. So if you remember, in the previous video we discussed obstetric, in the previous slide we have seen obstetric outlet, where the laterally it has ischial spines. Here it is having laterally ischial tuberosity. Coming to the diameters, here the AP diameter changes with position of coccyx, that is, it will be in a range of 11.5 to 13 centimeters. Coming to the transverse diameter, or you can say bituberous diameter, okay, this is the distance between two ischial tuberosity, that is 11 centimeters. Okay, if this diameter is less than 8 centimeters, then again you can say it is a contracted outlet. So the four knuckles, like this one, four knuckles can't pass between two ischial tuberosities, then that is also a indication of contracted pelvis. Next, coming to clinical pelvimetry. Clinical pelvimetry, what is this? Clinical pelvimetry is a clinical measure of measurements in primigravida. It is done between 38 to 39 weeks. First time, if someone is first time pregnant, that is primigravida, you will do this. Already in multigravida, already pregnant female, already you know that there's a normal vaginal delivery, so no need to do clinical pelvimetry, but it is done at only onset of labor to rule out any CPD. So it is not done to know the size of pelvis, only to rule out any CPD. CPD means the baby's head is more big when compared with pelvis, right? In that case, so we will check only at the onset of labor in multigravida. So now coming to angles which are related to pelvis, there is one angle called as angle of inclination. It is an angle made by pelvic inlet with horizontal, and it's equal to 55 degrees. Next, coming to another angle, that is a subpubic angle, and it is an angle between two descending rami of pubic bone, and in case of male it is acute, in the case of female it is obtuse. So this is like we have come to the half part of it. Next we'll start with other part by another video related to pelvis itself.